It can be unsettling to see someone's arms or legs start jerking rhythmically and uncontrollably, and it is natural to wonder when such movements are a cause for concern. You should worry about rhythmic arm and leg jerking when it is involuntary, repetitive, and especially if it is accompanied by a change in awareness, as these can be clear signs of an epileptic seizure. These kinds of movements indicate a need for prompt medical evaluation. The core reason to worry about these specific movements is that they often signal abnormal electrical activity in the brain, characteristic of a seizure. While minor muscle twitches, known as myoclonic jerks, can happen to anyone, especially when falling asleep, seizure-related jerking is distinct. During a tonic-clonic seizure, also sometimes called a grand mal seizure, a person loses consciousness and their body stiffens, and then jerks rhythmically and uncontrollably. Other types of seizures, such as some focal onset seizures, can also cause localized rhythmic jerking in one limb or one side of the body, potentially without a full loss of awareness. If you witness rhythmic arm and leg jerking, especially if it is repetitive and the person seems unaware or unresponsive, there are key steps you can take. First, ensure the person's safety by gently moving them away from any hazards. Then, carefully observe and mentally note what the jerking looks like, whether it affects both sides of the body or just one, and how long it lasts. This detailed information is incredibly valuable for healthcare professionals. Remember to time the event from start to finish. If the jerking lasts longer than 5 minutes, if breathing becomes difficult, if there are multiple seizures close together, or if it is a first-time seizure, call 911 immediately. Understanding the difference between a benign muscle spasm and an epileptic seizure is crucial. Doctors often distinguish these through careful observation and diagnostic tools like an electroencephalogram, or EEG, which measures brainwave activity. The rhythmic nature, coupled with altered consciousness and a predictable pattern, points towards an epileptic event, whereas isolated, non-rhythmic twitches are usually not seizures. These distinctions highlight why detailed witness accounts are so important for an accurate diagnosis. Ultimately, any instance of unexplained, rhythmic arm and leg jerking, especially if it occurs repeatedly or with changes in awareness, warrants a thorough medical evaluation. Providing a healthcare professional with accurate observations helps ensure a correct diagnosis and appropriate management plan, offering reassurance and helping to maintain the best possible health and quality of life.